Medicare coverage for lipid panels. CPT code 8061 Lipid Panel Laboratory includes the following three tests. 82465 is defined as cholesterol, serum, total. 83718 is defined as lipoprotein, direct measurement, HDL. 84478 is defined as triglycerides. The Centers for Disease Control and Prevention, CDC, recommend that adults over the age of 21 have their cholesterol tested every 4 to 6 years. If certain risk factors are present, you may request a lipid panel more frequently. The medical community recognizes lipid testing as appropriate for evaluating atherosclerotic cardiovascular disease. CPT code 83721 describes direct measurement of LDL cholesterol, lipoprotein, direct measurement. CMS has established national guidelines related to lipid panels as a National Coverage Determination, NCD 190.23. Some of the highlights of NCD 190.23 are: any one component of the panel or a measured LDL may be reasonable and necessary up to 6 times the first year for monitoring dietary or pharmacologic therapy. More frequent total cholesterol, HDL cholesterol, LDL cholesterol, and triglyceride testing may be indicated for marked elevations or for changes to anti-lipid therapy due to inadequate initial patient response to dietary or pharmacologic therapy. The LDL cholesterol or total cholesterol may be measured 3 times yearly after treatment goals have been achieved. Once a diagnosis is established, one or several specific tests are usually adequate for monitoring the course of the disease. Less specific diagnoses, for example, other chest pain, alone do not support medical necessity of these tests. If no dietary or pharmacological therapy is advised, monitoring is not necessary. The most important step you can take is to review the NCD guidelines before you submit a claim. Lipid Panel Orders Guidelines. Physicians may order any or all of the following tests to screen for cardiovascular disease: 82465, 83718, and 84478. These 3 tests comprise the lipid panel, so if the lab performs all 3 tests, report CPT code 80061, lipid panel, instead of the individual test codes 83721. Physicians may need to know LDL, and CPT provides a code for the test, 83721. But code 83721 is not a covered test for screening. Typically, the lab calculates LDL from the other lipid fractions measured in a lipid panel, so there should not be a separate charge for a calculated value. So it would not be clinically indicated to bill these 2 codes on the same day. Understanding Medicare coverage for lipid panels and adhering to the established guidelines is crucial for both healthcare providers and patients. The CPT codes for lipid panel tests, including cholesterol, HDL, and triglycerides, are essential for accurate billing and monitoring cardiovascular health. The CDC's recommendations and CMS's NCD 190.23 provide a framework for the frequency and necessity of these tests, ensuring that they are used appropriately to evaluate and manage atherosclerotic cardiovascular disease. Physicians must review these guidelines carefully before submitting claims to ensure compliance and avoid unnecessary testing. By following these protocols, healthcare providers can effectively monitor and treat patients, contributing to better health outcomes and efficient use of medical resources.